Hey, welcome to Don't Take This, your spot for clear, straight up information about medication so you never have to make a health decision in the dark. Today, we're jumping into Zolmitriptane. We're going to cover what it's for, how it actually works, and all the crucial side effects and practical tips you absolutely need to know.
So, before we can even talk about a specific medication like zolmitriptan, we really need to understand the problem it's trying to solve. And let me tell you, when we're talking about migraines, we are talking about something way more intense than your average headache.
Okay, so this is the official clinical definition. And if you've ever had a migraine, you're probably nodding your head right now. It's not just pain, right? It's this whole body takedown. That insane throbbing, the nausea, not being able to stand any light or sound. It's the kind of thing that just puts your entire life on pause.
When a headache hits, what do most of us do? We reach for some Advil or Tylenol. But for a real, full-blown migraine, those often don't even touch the sides. So what happens when the usual stuff just doesn't work? That's when you need something way more targeted. And that's exactly where zolmitriptan comes in. You might know it by its brand name, Zomig. This isn't your general all-purpose painkiller. No, this is a prescription medication specifically designed to stop a migraine attack in its tracks.
All right, let's get a little geeky for a second and look at the science. What you're seeing here is the molecular structure of zolmitriptan. It belongs to a class of drugs called triptans, which were a total game changer back in the 90s because they were built from the ground up to target what's actually happening in your brain during a migraine.
So what's the magic here? How does it actually stop that agony? Well, it's a brilliant two-pronged attack. During a migraine, the blood vessels around your brain literally swell up. Zolmitriptan's first job is to narrow them back down to their normal size. At the same time, it blocks your nerves from releasing all those nasty chemicals that cause the pain, the nausea, and all that sensitivity. Okay, but wait a minute. That whole narrows the swollen blood vessels thing, that sounds a little intense, right? If it's tightening up vessels in your brain, you gotta wonder, what's it doing to the most important blood vessels in your entire body? And this is the big one. This is the question that's on everyone's mind, both patients and doctors. The fear is that if it's constricting blood vessels, could it potentially choke off blood flow to the heart muscle itself? That sounds pretty darn risky, so let's dig into what the actual data says. Now, check out this quote from a major study at Duke University. It kind of flips the whole conversation on its head. What these researchers are saying is, yeah, the cardiac risk is a real thing we have to respect, but by overhyping it, we might actually be stopping millions of people from getting relief from some truly awful pain. It's a classic risk versus benefit situation.
And this chart? This just drives that point home. It's kind of wild when you see it laid out like this. The group that gets migraines the most, young women, is the very same group that has the lowest risk for heart disease. This mismatch is totally central to understanding the real-world risk. And this is the number that really stopped me in my tracks. The same analysis came to this stunning conclusion. The trade-off is huge. For every single heart attack you might prevent by telling people to avoid triptans, you'd be leaving 16 people to just suffer through their lives with untreated, debilitating migraines. Okay, so now that we have a much better handle on the risk, let's get practical. Let's talk about who should be taking this medication and, just as importantly, who absolutely should not. Right, so this is absolutely critical. While the risk is low for the average patient, it's definitely not zero, and for some people, it is a hard no. If you have any history of heart disease, a past heart attack, or a stroke, or if you have high blood pressure that isn't under control, this is not the medication for you. Same goes for some rare heart rhythm issues, or if you've recently taken other migraine meds or certain kinds of antidepressants. So what's a typical starting dose? For most adults, it's going to be 2.5 milligrams, and you take it right when you feel that migraine starting to come on. And this is super important. You absolutely cannot go over the maximum daily dose. If the migraine comes back, you can take a second dose, but only after at least 2 hours have passed. But the grand total in any 24-hour window should never, ever be more than 10 milligrams. One of the most popular forms of this is the tablet that just dissolves in your mouth. They call it an ODT. Here's a little pro tip. You have to peel back the foil on the package. Don't try to push the pill through or it'll break. You just pop it on your tongue, let it dissolve, and that's it. No water needed, which is a lifesaver when you're feeling nauseous. All right, let's talk side effects, because let's be real, pretty much every medication has them. This chart shows what people reported in clinical trials. You can see things like dizziness and drowsiness are about twice as common as with a sugar pill,
But I want you to look closely at that third one down, that weird sensation in the neck, throat, or jaw. Let's unpack that a bit more.
Okay, that sensation we just mentioned, it's the side effect that freaks people out the most, and for good reason. A lot of people feel a sense of tightness or pressure, sometimes even pain in their chest, throat, or jaw. Now, you should always take that seriously, but it's important to know that this is a really common tryptophan effect. For most people, it's not related to the heart, and it usually goes away within an hour or so.
And just a few other really important things to keep in mind. Based on animal studies, it's generally not recommended during pregnancy. For breastfeeding, the levels that get into milk seem to be pretty low, but some women have reported breast pain. And finally, there's a small but very serious risk of something called serotonin syndrome if you take this with common antidepressants like SSRIs.
Whew! Okay, that was a lot of information. So let's boil it all down to the absolute must-know takeaways.
So at the end of the day, it all comes down to this trade-off, right? The benefit is crystal clear. You get powerful, targeted relief from absolutely miserable pain. The risk for someone without any heart problems is considered to be really, really low. But for anyone with a history of heart issues, that risk is just too high to ignore. And look, if there is one thing you take away from all of this, let it be this. This is not a medication to mess around with. Don't borrow a pill from a friend. Zolmitriptane can be an incredible tool, but an honest, in-depth conversation with your doctor is non-negotiable. They're the only ones who can tell you if it's safe for you.
So I'll leave you with this to chew on. The whole story of triptans shows how our understanding of risk versus benefit is always changing, and it really makes you wonder, how many other people suffering from chronic pain could be helped if we had a clearer, more honest picture of who these powerful medications truly help and who they might actually harm?